Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for Better Business, Better Health. Here at HIMSS 2022, and I'm here with Dr. Steve Waldren. He is the Chief Medical Informatics Officer at the AAFP. Steve, thanks for joining me.
Thanks, Nick. Appreciate it.
So why are we here? What are we talking about?
So what we're talking about for our members, we're trying to drive innovation to address some of the biggest challenges in family medicine and primary care. The epidemic of burnout, the helping our docs get off the fee-for-service hamster wheel and make transitions to some type of value-based payment model, and to really take these advantage of these new artificial intelligence and machine learning type of technologies and bring them into family medicine to address those big challenges. So we started our lab, and we have one company that we've been working with that has an AI assistant for documentation, which has shown significant improvements in that documentation burden for our members.
So, I mean, one of the things that happened a number of years ago was we introduced technology, and I would say that contributed to burnout.
Yes.
You're saying that you're introducing technology and it's going to counteract that. Tell us a little bit about why and what's going on.
Sure, yeah. So I think it's a twofold. One, that we're really focused on the needs of the physician, not the needs of like the health system or the organization or the C-suite. But these are really solutions that are really designed for the physician first and foremost. And really, we only focus on those solutions that are addressed on those biggest problems for primary care and family medicine that I just spoke of. So I think that's one of the number one reasons. The other is that we're trying to work with companies that have a track record, or at least their leadership has a track record in more of the consumer space. So the types of technologies that they build and the deployment models that they have are more like an app on a phone than a large enterprise thing. So I think these are more adoptable and really focused on being able to use it in practice.
So the AAFP is essentially creating, an innovation lab that's trying to sort of generate those solutions that are focused on clinicians, not exclusively burnout clearly, but functionality. What was the genesis of that? I mean, that sounds like it's not revolutionary, but it's certainly new for you, right?
Yeah. So we had done a lot of advocacy for health IT for a long time. I've been with the Academy for many years, and we saw some improvements in the technology and the interoperability, but it just wasn't fast enough, and it just wasn't enough. So our board of directors decided to really invest in really driving innovation into family medicine to really try to accelerate things. So in 2018, we started a special project that started this new lab where we go out and try to find technology that's emerged. So this is technology that's currently readily available in the marketplace. It's just not yet to be adopted. We're not looking for beta product, something that docs can pick up and start using today. So that's kind of where we're focused on those technologies.
So this is really innovation, but not the early stage. It's things that are actually functional and an opportunity, I guess, to engage with a population that's really wants this stuff, and there's a ready-made set of users that will take this on and try it.
Yeah, absolutely. So we found in our work kind of in the EMR space, finding a doctor like me in a practice like mine that's had success is the best driver, at least in family medicine, to really drive adoption. And I think making sure that we validated with a subset of our population that this type of solution works in practice is a critical piece of our innovation lab.
And that's what you found with this technology. What's it doing, and why is it so special?
Yeah, so this particular technology, again, like I said, is an AI assistant for documentation. So it's like using a Siri or Alexa, and you just talk into it to do your documentation. So you can say, Suki, show me my schedule for today, and it will integrate with your EMR, pull that schedule up, and you'll say, okay, Suki, create a new progress note for patient Jane Smith. And maybe you have 6 or 7 Jane Smiths in your practice, but there's only one that's on your schedule for today, so it's smart enough to realize that that's what it is. So then you're able to say stuff like, bring my note forward from last time, Suki, change abdomen to distended. So it actually, you don't dictate, you give it commands to be able to do. Yeah. So what we saw in our lab, which we had 132 folks that participated, so those that trialed it, which means they had to have at least 5 notes using this technology, they were able to decrease their mean note time by 72%. So we saw some of our docs going from 10, 12 minutes of documentation time to 2 to 3 minutes of documentation time.
Wow, that's really cool. So this is exciting. Great that we're focusing on the family practice, an area that I think everybody has realized in the pandemic, essential technology, essential resources, really driving an awful lot of healthcare, but I think underserved from an economic standpoint. This is economic. Look forward to hearing about it some more. So thanks for joining me today.
My pleasure. Thank you.
This is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.